Hi, I'm Dr. Joshua Huffman, owner of Mounds Chiropractic and the author of this book, Growing Young. This book is a book that covers natural alternative solutions to really a wide array of different health conditions, ranging from migraine headaches to back pain to neck pain to whiplash injuries, and even to many chronic degenerative conditions like neuropathy, fibromyalgia. My goal in talking to you today is really to share some light with you on whiplash injuries. It's that time of the year again, there's lots of snow on the ground, and many people will be suffering car accidents this year. It's certainly an unfortunate and a frustrating thing when you're involved in a car accident, but it can become even much more frustrating if you don't act on the signs of dysfunction that occur within your body. I regularly see it in my office that patients present 2 years later after suffering an automobile collision that's caused them neck pain, headaches, and a lot of chronic disease conditions. If you don't act on it now, you may not only not be able to fix those problems before they develop, but you may be left with chronic pain moving forward in your life, and you also may be left with a big bill that unfortunately is not covered. So I want to share with you a little bit about what goes on in a car accident. When you're involved in a car accident, the impact that goes through the car is passed through your spine as well. And so if there's enough damage that it even dents the metal of the car, that is enough trauma to cause damage to your spine. When you suffer a whiplash injury or are involved in even a low-level automobile collision, there are going to be ligaments and muscles that stabilize the joints in your spine that are damaged. They actually tear. Okay? This is just like an ankle sprain. So those of us that have suffered ankle sprains or wrist sprains, there's a couple of things we know. First of all, they're extremely painful. But secondly, they never seem to heal up and come back as strong as they originally were. The reason for that is because when you sprain those ankles and you tear the ligaments that stabilize your ankle joints, your ankle heals with scar tissue in it. That scar tissue is not innervated by nerves in the same way that the original ligament was. And that scar tissue also does not have the same strength and laxity that the original ligaments had. This is the exact same thing that happens in your spine when you suffer a whiplash injury. If you've damaged the ligaments in your neck, you've actually torn those ligaments. And those ligaments, if not healed properly, will develop scar tissue, which prevents normal movement of your joints, which will cause restriction in your range of motion. It'll also cause degeneration, which we'll talk about in just a few minutes. It also causes you to have more likelihood of pain and also a greater risk of increased aggravation and injury in the future as well. So how does this scar tissue develop? Well, when you suffer that injury and you damage the ligaments in your spine, as those tissues heal, if there is not proper movement in the joints, as those tissues heal, that scar tissue will form. And so what happens is you with a whiplash injury, you have restrictions, you have joints that have moved out of their normal alignment, you have damaged tissues, and you have increased inflammation around those joints. With that, it leads to a restriction of normal movement of that joint complex in your spine. When that joint stops moving, you're not going to be healing that tissue properly. You're going to end up having that scar tissue. And you're also promoting pain on the segmental neurologic level. You see, when your joints in your spine are moving normally, so there's normal movement, they're in their normal alignment, and you're active, you fire off what are called mechanoreceptors in the spine. Those are basically movement fibers. Those movement fibers fire back and inhibit pain fibers on the segmental level. So your actual ability for your joints to move properly helps you to inhibit pain signals that go to your brain. This is very important because when you have that decreased amount of movement in the spine, it leads and it promotes chronic pain in your system. Now, what does chiropractic do to help your spine recover properly from an accident? Well, chiropractors are trained and specialized really in finding and locating areas of restricted joint function. So we're going to actually locate the exact areas where your joints are no longer moving appropriately, and we help to restore proper movement to those joints while the tissues are healing. This is very important because it helps increase blood flow to that area. It also helps prevent scar tissue from forming in the muscles and ligaments as it heals. Like we already stated, when we move those joints, that movement actually inhibits or quiets down the pain signals that are being sent to your brain. So chiropractic should be playing a very integral role in your approach to healing after a whiplash injury. Now, many people ask, should we go to our medical doctor before we go to a chiropractor after suffering a collision? If you have any major concerns, okay, if it's a severe trauma and you're concerned for fractures, broken bones, if you have major bruising, if you're feeling very nauseous, I would recommend that you seek immediate medical attention first before going to the chiropractor, so you can rule out any majorly complicating problems. After you've been to the medical doctor, come in, see a chiropractor. Chiropractors will help restore normal movement, normal health back to your spine. As we talked about, this can also lead to chronic problems in the future if this is not dealt with appropriately. See, that same thing that we talked about, if you don't get that normal movement restored into your spine right after a car accident, you're going to end up developing chronic degenerative changes in your spine and arthritis in your spine. You know, many people think that arthritis is just a normal part of the aging process, and it certainly isn't. You see, osteoarthritis developing in your spine is really a reflection of how well your joints in your spine are moving. And so it's very important that we keep those joints moving for as long as possible. And so it certainly pays, again, to get that checked out immediately after a car accident rather than wait. Okay? The last thing I want to mention is how does insurance work with suffering a car accident? Well, your car insurance is responsible for any injuries that you've sustained in your motor vehicle collision. Now, the important thing to understand with this is that if you put this off and you end up developing or having headaches 6 months, a year down the road after your auto accident, your insurance is no longer going to be liable for that, and that cost falls to you. And so another added benefit of getting your spine checked immediately after an accident, if you're having any sign or symptom, is that we may be able to prevent the bill falling back on you later on. Okay? And so please, I hope you take this information. I know this information can change your life and change the lives of those that you love. I see it regularly in my practice, people that have suffered a car collision who never received the treatment that they needed. And now years down the road, they're suffering chronic, debilitating really conditions. And so please take this information, act on it. If you have been or ever are in a car collision, make sure to get in to see a good chiropractor. We would certainly love to help you if you're in our area, but even if you're not in our area, I strongly recommend get in, get checked. It can really change the quality of your life moving forward. So thank you so much for taking the time to watch this video today, and I hope it changes your life. Have a great day.